healing. It is something we tend not to think about until we need to actually do it. Dr. Jennifer Heller is the medical director of the Wound Center at GBMC, and she joins us now. How are you?
Good morning. How are you?
Good, good. I'm happy to have you here. And of course, I feel like I know the answer, but of course, I need to ask someone with your medical expertise. But describe the scientific definition of a wound, just as a base point before we get started.
Sure. It's really a very basic definition. It just has to do with an opening of the skin. It can be due to trauma, could be to surgical trauma, trauma with any kind of event or object or being.
And so when we think about summer and even going into fall, how do we prevent wounds?
Well, it's pretty hard to prevent wounds from occurring. It's always good to exercise caution when we're doing fun summer activities like hiking or biking, anything that we're doing outdoors, particularly now with COVID. I think that's all pushing us outside, which is fantastic.
Mm-hmm.
Sometimes we can develop wounds from insect bites. So it is helpful certainly to make sure that you have insect repellent on. Sometimes we can get wounds from severe sunburns. So again, protecting ourselves against the sun in ways that our primary care physicians and providers tell us about is also very helpful.
All right. And then when should we seek treatment from the wound center? How do we know when it's gotten to the level that we need to get some help from the wound center?
Certainly, anytime you have a question, you're concerned, please feel free to call us because that's really what we're here for. But if you feel like you've started treating your wound and everything looks good and it doesn't have an odor, you don't have a temperature, there isn't drainage coming from the area, there isn't redness over the site that appears to be increasing. If you have none of those things, then don't come. But if you do, certainly please call us.
Got it. And to get in front of it, you sort of talked about the things that we can do at home. What should we have in our medicine cabinets just to make sure that we are well prepared?
Peroxide is not what we want anyone to be using. It's a common myth. A lot of people think that peroxide is a really helpful agent to clean wounds. Very gentle soap and water is fantastic. Anything that's hypoallergenic. And then a dry gauze or a dry Band-Aid, which is very helpful. It's also good to have a triple antibiotic ointment that you can initially put on the wound as well if needed.
And I have to ask you, what is the deal with peroxide? Because I feel like a lot of us and many of our viewers at home are like, I've been using this for years. Can you explain why we shouldn't be using that?
It damages the skin and the soft tissues. So it actually does more harm than good.
Well, we learn something new every day, and I'm glad that you're sharing that with our viewers as well as myself. I learned something new as well. What should we be bringing with us when we travel? Because I know that a lot of us, like you mentioned, are getting outside a little bit more. There are preemptive things that we can have on us to make sure that we are in good condition in case we do get a wound.
Yeah, and I think that the word that you used is so important, which is prevention, because that really is a tenet of wound therapy. How can we be preventative and then proactive and try to help ourselves should we, develop a wound. So certainly, again, anything that we can do to brave the outdoors, insect repellent, high SPF sunscreen, covering our ears, our head, long pants if we know we're going to be, hiking. And if that doesn't work, what should we have on board? We should certainly have, again, things that we've just discussed about our medicine cabinet. Nice dry gauze, something that you can have a spray wash, hypoallergenic spray wash is perfect. And then a little Band-Aid on top is great.
All right, Dr. Jennifer Heller, you always break these down in a way that we can understand and break down the myths. We really appreciate it. And we'll be right back with more Midday Maryland right after this. Stay tuned.